Welcome to the Healthy You podcast from North Shore University Health System, where we explore trending topics in healthcare. I'm Carolyn Starks.
And I'm Jon Hillenbrand.
I once read that inspiration propels a person from apathy to possibility and transforms the way we perceive our own capabilities. In essence, that is what this two-part series is about. In part one, we interviewed Art Muir, the oldest American to summit Mount Everest. In today's episode, we have with us Dr. Mark Bowen, an orthopedic surgeon at the North Shore Orthopedic and Spine Institute. And we're going to find out what Dr. Bowen said when he found out his 75-year-old patient wanted to climb Mount Everest. Dr. Bowen, tell us what you do at North Shore.
My name is Mark Bowen. I'm an orthopedic surgeon at North Shore. I'm Division Chief of Sports Medicine and Shoulder Surgery.
So what was your reaction when Art told you he planned to climb Mount Everest?
Truthfully?
Yes, truthfully.
Yeah, sure. I knew Art was a very avid workout guy. He was very motivated, and I knew that he had done some climbing, and I wasn't exactly sure what other mountains he'd been on, but over the course of probably knowing him for 10 years plus and knowing his body a little bit, I knew that he was an active guy, so he suffered some of the typical things that people who are exercising at his level and his intensity would have. And I think we sort of took each one on an individual basis, and his goals were always broad and highly active. But I'm not sure when the whole Everest thing came along or the mountaineering thing came along. To be honest with you, I think the first time I really knew about Everest was after he had come back from his first attempt.
Oh, in 2019, right?
In 2019.
Yeah, and what happened then? He touched on that a little bit, but what?
He scared me. And I didn't go too deep into what happened, but I believe he was crossing a crevasse and was on one of those metal ladders.
Wearing crampons, right?
Yeah, which probably doesn't go with metal ladders very well.
Right.
So my guess is, again, just, from what I've seen in movies and pictures, he either slipped or fell and was in the crevasse. And my recollection is he was telling me that it wasn't as simple. He just climbed himself out of the crevasse. Wow. So I think he had to be rescued.
Yeah.
I don't think it was simple. And the reason I recall that is because my reaction to that was thinking, okay, that's enough.
Yeah.
If you're looking for a sign.
Yeah, if that was, exactly. And I don't know how clear he was with that with his family and everything else, because I think they might have reinforced the same thing.
Right.
And I can't recall whether I was aggressively deterring him at that point, but it became clearer to me that he was going back later on because I'd operated on both his knees and his one rotator cuff, and he'd had a chronic tear of his other rotator cuff, which in his shoulder, and he wasn't too symptomatic from it, so he had chosen to rehab and try to treat it conservatively. And then I believe he was in the full determined, I need to have my body the best it can be kind of stance. And he said, all right, I want to get it fixed. Unfortunately, at that point, it was a little bit more complicated than a simple rotator cuff repair in terms of size, which is usually the biggest determinant of ease of surgery, ease of recovery, success, outcome, how functional you get. But he was very motivated, as he was with pretty much everything else that we dealt with him. And
this is just 2 years before he made the climb. He had this complex surgery on his shoulder. Yeah.
Correct. So
in layman's term, what did you do?
Yeah. So the rotator cuff is a conglomeration of tendons from 4 different muscles, and most people who have rotator cuff tears or rotator cuff surgery for that is usually a one tendon tear. That's the vast majority, and sometimes the tear extends into a second tendon, sometimes a third. And he really had a fairly large 2-tendon tear that had been pulled back, kind of like a window shade goes up to the top of a window.
Wow.
For quite a while. So the surgery wasn't simple, just put back. We had to do some rotating of the tendon to get sort of less important part of the tendon up into an area that really is important to lift his arm. And
is that like something that you have to like physically pull on like really hard to like get it into place or during surgery?
There's a little bit of that. Yeah, a little bit of water skiing on the rotator cuff tendon.
Wow.
But do you have to connect it to the other side, so to speak, or no?
Yes, you do.
Okay.
So there's a couple parts. So the rotator cuff is a tendon, like all tendons attached to bone. The goal of surgery is to put it back to the bone where it came from.
Okay.
And sometimes you can just do that directly, and other times in this situation where it's so big, you have to kind of sew the tendon to the tendon, and you have to do it's a little bit of plastic surgery to the tendon, meaning we have to rotate part of the tendon, and it worked.
Wow.
But the biggest part of that is really, the patient and their, in his case, strength and of will to do the rehab to get ultimately his shoulder to function well, and
especially if he's going to be rappelling, or just the strength he needs to pull on ropes and
ropes and axe, ice axe and the whole bit.
And when you're going to Everest,
Yeah.
explain to us the importance of your shoulders, because you're not rappelling, are you?
Yeah.
Or you are?
You do.
Okay.
Yeah, you do a fair amount of rappelling. As you get better and better, you actually use arm wraps, so it's like kind of a different way of getting down, so it doesn't take quite as long as rappelling. But yeah, you have ice cliffs that you're going down through, the Khumbu icefall and stuff. So you need it for that. But the thing you really need it for is just general balance and kind of protection, and you're putting packs on and doing all kinds of stuff. So you have to have some strength. But the thing where you really need it is Everest is a fixed line climb, almost from base camp, almost all the way to the top. There are very few places, but there are some where there are no ropes. So you have this thing called Jumar, or an ascender, which is a one-way handle you put on a rope, and you can slide it up, but it won't slide back. Mm-hmm. The idea is it protects you once you've taken a step up from falling backwards or off the mountain. So what you're doing is you're working that thing all the time. I mean, I don't know, thousands of times you're shoving this thing up the rope.
Right.
And sometimes it's left-handed, sometimes it's right-handed, but you're doing it all the time to stay attached to the rope. So that's a shoulder movement. And if your shoulder and your arms and stuff aren't strong, you just can't do it. And there's a lot of other stuff, but you can't do it without an effective shoulder. I mean, you can't climb.
And is this something that, after you've had a surgery like this, is the risk of re-injury higher than a regular person?
Yeah, so if you just compare it to normal tendon, of course, the risk is higher. If you look at the size of the tear, the complexity of the repair, the risk goes up. So a lot of times we like to deal with them a little bit earlier.
Yeah.
And, I think for a guy like Art, he's a busy guy. It's hard for him to stop and do 6 months, have surgery and have 6 months of PT and get it all back together. And I think ultimately his motivation to accomplish what he wanted to accomplish sort of dictated I need to get as good as I can get.
So what's your advice for someone who has had surgeries like this when they tell you they want to go to Everest? What would you normally
What do you tell your other patients that climbed Mount Everest?
More likely it's what do they ask if I can go do P90X or Insanity or something like that, and I say please don't.
Right.
So if somebody were to say to me, I want to have the surgery and climb Mount Everest, I'd say please don't with a bigger exclamation point probably.
Right.
But that was not likely to deter him. And if being in a crevasse off a ice ladder didn't deter him, I don't think having shoulder surgery. It made me nervous for him. It's just, from knowing him and just the personal risk. But I don't think he would have listened to me if I told him his shoulder was going to keep him from climbing Mount Everest.
Well, the thing is, it's not just his shoulder. So he had, with you, knee arthroscopy, right?
Correct.
with meniscus surgery, 2009, 2012, shoulder rotator cuff repair, 2017. The other knee, same thing, looks like similar meniscus surgery, and then 2019, the one we just talked about. So, I don't know, you put all that together, plus he had a neuroma on his toe, put all that together, and then you add his age. I mean, that's pretty incredible. I mean, what...
It's
Do you
remarkable.
kind of try to, like, let's talk about this?
I think we did have a little bit of a talk like that. And so when I heard he was going again, it sort of defied, general common sense and logic. But it was a super passion for him. And, I think the injuries that he had are fairly typical of people who are active as he was, doing, if you put your body through a lot of stresses, that's why I have a job.
Yeah, right.
Those are choices that we make, and, sedentary people suffer from other problems. So there's
Right.
always, potentially a trade-off. I just think, when you really look at what people do, it's not just you wake up one day and you say, I'm going to climb the tallest mountain that people die on.
Right.
Yeah.
And he prepared, prepared very conscientiously and vigorously. And I think if he didn't, he wouldn't have been successful. And
Yeah.
if he didn't, he might not be here.
Yeah.
I don't think it was without a lot of thought, planning, and then more importantly, just hard work.
In many ways, he is like the perfect patient in that sense, in terms of like what you tell him, here's what you need to do for therapy. He said he did it. Like everything that the doctor said, he followed the doctor's orders, like to a T.
Yeah, no, there's there's no question that picking the right patients is probably the most important part of being a successful surgeon.
Right.
And if you can find a motivated patients, they're going to make things look good all the time.
Oh,
Yeah.
that's sweet. But Art had so many nice things to say about you, and
Yeah.
unprompted by us.
It's been great because, like everybody my age, I have issues, but I have issues that can be treated and fixed. That's what's so remarkable. Mark Bowen, for instance, an orthopedic surgeon, has done 3 or 4 arthroscopic procedures on my knees. One of them was done right before Shishapangma, and that was a home run. That actually made a huge difference. And then I went back to him because I'm still having trouble with one of my knees, and I have both a lateral and a medial tear currently in the meniscus. So we had to talk about what to do, because I wasn't going to get more arthroscopic surgery before this, but I also wasn't going to not go on this trip.
Because of the recovery, right?
Yeah,
Or-
yeah. You just can't train, and you can't take off that kind of time when
Right,
you're training. I've been
right.
training, you can talk about it for like 3 years, but intensely for 2 years before this trip.
Wow.
And we ended up with a cortisone shot,
Yeah.
and I had no issues with my knee. I still haven't had any issues. Knock on wood here. Where's the wood? Where's the wood?
Yeah.
Knock on wood. So that's been great. He also did 2 rotator cuff surgeries. When he went in there, he said, that was not good, okay? There was there was a hole there, and it's supposed to be a tendon and a muscle. He had to do this really pretty sophisticated procedure at that point. He could have just, closed it back up and said, you need a new shoulder. But, he didn't do that, partly because he knew I was planning on trying to do a lot
Everest?
more stuff.
Yeah.
Yeah. He's so great. These docs have all been great. But Mark knew that I wanted to recuperate and rehab this shoulder. But so
Right.
for 1.5 hours a day, 3 days a week, for 15 months, I worked on the rehab of that.
Wow.
And by the time I was going to Everest, I could do pull-ups and chin-ups and push-ups and stuff. It was amazing, actually.
So literally saying that he was talking about his body, and he said, I felt like I became stronger in like a well-oiled machine. I didn't have any trouble with my knees or my shoulders. And I do thank Dr. Bowen for that, and other North Shore team members, because I couldn't have done it without them. And, it is one of those cliches, like every person played a part, you know what I mean? But he played the biggest role, obviously.
Yeah, I think that's true. I mean, I think you can't do what he did without probably having a team of people that are supporting. But I mean, if you just imagine, take a second and imagine what it would take to prepare to do that. It defies. I'm a pretty active person. It still defies my even imagination of what I would have to do to prepare for that. So I think if you have a goal like that, I mean, it obviously is inspirational to everyone and at any age, but at his age, which you can't get past.
Right.
And you just observe what he accomplished and really how it's not a foregone conclusion that it can be done.
Yeah, I was going to ask you, there's this thing in psychology called adaptive preference formation, where if you try to reach for an apple on a tree and you can't reach it, you just say like, oh, I never wanted that apple anyway, and I think a lot of people tend to set their goals based on their personal pain level. Like if they have bad knees, they're like, well, I can't ride a bike today, or I can't ride a bike ever again, you know? So like, what do you say to people who are using pain as like a way of setting goals?
Well, it's tricky sometimes because everybody experiences pain in a different way. Mm-hmm. And you certainly, as a physician, hard to deny somebody the fact that they are in pain. Right. And it's difficult to say, oh, no, don't worry about your pain, push on. So I think it's so individual with patients. And sometimes you don't know them long enough to really totally get where they're coming from or who can be perhaps encouraged, pushed.
Do you think everything can be checked out by a doctor? Like if someone just has like, oh, I'm just old and I have bad knees, do you think like everyone should come in or do you think like there's just a certain level of, you just gonna have to live with that?
I think that that's super individual because truthfully, I have patients that have pain for one day and they're calling for an appointment,
right,
without an injury.
Yeah,
and that's a little bit of a defining line sometimes. So if certainly you fall or you have an event, that's often a really important trigger. But some people are trying to run or exercise, they have pain, and they immediately think, I got to see a doctor. And I'll have some patients that will go an extended period of time, way too long, before seeing someone. So it's hard. It's often hard to say, a week of this or 2 weeks of this, you should do it, because there's so many factors. But I think because healthcare is available, and we have so many people in orthopedics at North Shore that are either primary care sports medicine doctors or orthopedic surgeons or physician's assistants, and even now you can be evaluated at physical therapy centers. I think people, if they have questions, they should get checked out. The best thing you can do is say, you look fine, and they'll say, I wasted your time. You never waste the time if everything's good.
Right, because one of the things Art was stressing, one of his messages is that just if you have pain or something going on, don't just accept it like this is part of old age. Just go get it checked out. Yeah. Still have a dream, which obviously his was huge. And his other message was, if you exercise your body at any age, it will respond.
I've worked with a lot of people and been around a lot of people who are outstanding athletes, college, professional, Olympic, not just in regular sports, but also in mountaineering. But that's not who I am. But the point of this is, what I've learned is that even at my age, if you can avoid the big problems, heart disease, cancer, dementia, diabetes, all those things that we all struggle with, and do the right kind of exercise, your body will still respond to the right stimulation.
I wondered what your impression was of what his body at that age was able to accomplish.
Yeah, I completely agree with both of those things. And I think that just reflecting on how I exercise, there's certain things that are not as easy to do in exercise as you do before, but you definitely can stay fit, stay healthy, and your body, if you do it in the right way, in a smart way, and maybe you get advice on that, you don't have to break down by exercise if you pick the right exercises. If you're 65 and you go to a trainer and he's telling you to flip tractor tires, you may have a problem.
Something's wrong with this.
Which I've had patients do. But so if you do appropriate things in exercise, I think it can be very beneficial from a muscular point of view, from your skeleton, from your overall health, and I totally encourage people to do that. I discourage people from doing things that are fads or not properly thought out and supervised. There are exercises for 18-year-olds that just aren't appropriate for, us as we get in your 50s, 60s, 70s. And I think Art was fortunate because his body held up. Not everybody's might, but I understand why he says what he says, that his body, grew to the exercise in a way. And I think that's a good lesson that people can take from this, that, don't under-expect what you can do.
What was that moment like? Do you remember when you found out that he actually did it? And I don't know if it was on news reports or whatever. And were you feeling like a proud dad?
Well, I was very, very happy for him. My nurse actually sent me a text with, I forget if either a screenshot of something or the actual site that she saw it on. And I mean, I work closely with a medical assistant, a nurse, and a PA, and they all know Art really well. And everybody was, that was our thread, and everybody was texting back and forth, and very, very excited for him because he's a great guy.
He is.
And
I know.
he really is. He's a fun patient to have in the office. He's very positive, and just everything is good. So he's an easy guy to really like and cheer for. Yeah. And I mean, I was like, I knew he was headed there, and I had heard some reports about COVID on at base camp, and that's kind of all I had heard about the trip. I think my PA was following him on
Instagram or something.
One of his one site, and we had looked maybe the week prior or 2 weeks prior, and we were looking at it in clinic, and life gets busy, and the next thing I know, he's the oldest man in the United States to summit Everest. Wow. Which is really, fantastic. Yeah, it's definitely one of those kind of where were you moments that,
right?
Yeah, it's just incredible. And then I saw him on the Today Show, and he was, I don't know if you saw that interview, but
I did.
It was...
he was still over there, right?
Yeah, he was. Yeah. I think he was in Kathmandu. And, it's great. It's amazing. And I don't know if you all even know, but Operation Walk, which is a philanthropic organization that's heavily, heavily sponsored by North Shore and the physician and supported by the orthopedic department, they've for a long time supported the orthopedic hospital in the hospital in Kathmandu. So
and helped build it, right?
Yes. Yeah. And really, when they had the bad earthquake a number of years ago, a couple of physicians, Dr. Cordes and a few other people, went over and took care of fractures for a month over there. So the hospital's tie to that area in Kathmandu, and those guys have, unfortunately, I haven't been there, but my wife and two of my sons who were interested in medicine went there, and wow, they've taken helicopter rides up to like base camp, and I'm like, whoa, I don't even want to take a helicopter ride to base camp, much less climb there.
That's amazing.
So the connection to North Shore is pretty substantial.
He did say being an attorney and having to go over like negotiating tiny little bits in these contracts and stuff really helped him when he got to the point where he was just looking and placing every single step and then resting and stepping and resting. And
I mean,
it's really funny.
I'm sure it's almost impossible for anybody to even comprehend doing it.
What it takes.
Yeah. I mean, all you have to do is like see a movie like Into Thin Air or something. You're like, yeah, not for me.
Right.
Exactly. And then you're like, why? Just why?
Yeah. I mean, I think there's certain people and personalities that that just have to have that, kind of goal that,
There's that phrase, the mountains are calling and I must go.
Yeah.
I think Muir said that, not him, but a different Muir.
Yeah.
But yeah, I like that statement.
When you know somebody that's really accomplished something extraordinary, and clearly this fits.
Yeah.
At any age.
Yeah.
I mean, truly at any age. I mean, I don't think people just, bop up Everest.
No.
Right.
And to be able to go through the rigorous preparation, it's pretty impressive.
Yeah, I remember he was saying too, like, so he started off with a certain type of training, then it was more like, what is it, like something more like for probably one of the athletes you treat, like strength or...
He said more endurance than like a football player type that had more like...
Sprints of energy. And then he went to uphill athlete and they talked about lung endurance and all these other things, which I think really changed his
physiology.
Yeah.
Yeah, I think the other thing about something like this is that for many people, life doesn't allow you the time and opportunity to train and go do something like this when you're young and you've got a job and a family, and then you maybe retire or you get closer to that where you maybe have a little bit more control of your life, and now your systems aren't prepared to do it.
Right.
And I think for me, it inspires you to think, well, I don't have that much time to do that, but I've got time to do something, right? And I think a lot of people, especially even in the last year and a half, have postponed a lot of things. And personally, I look at it and go, wow, if he can do that, I can, we can, there's a lot of things. It doesn't have to be Everest. It can be some other little more realistic goal that you have that is reachable. And I think the training is a big part of that. Personally, for me, I've done some, semi-vigorous bike trips, and they're great because having that event to train for is a very motivating thing. And so I think for a lot of people, if you have something that you want to get to and that it requires some regular physical exertion and preparation, it's probably a really good thing, mentally, physically, life experience-wise.
Well said.
Well, thank you so
Sure,
much.
my pleasure. It's great to see you guys.
Yeah,
Good to see
same
you.
here. All right, so thank you for being here once again.
Yeah, thank you so much.
Until next time, this has been the Health for You podcast from North Shore University Health System.
Stay safe, wear a mask.
And get vaccinated.